Hello everyone. Welcome to 10th episode of Mental Wellbeing during COVID-19. We have Professor Amin Azzam, the guest speaker for today. Professor Amin is a psychiatrist and a faculty member at three San Francisco Bay Area universities: University of California, San Francisco School of Medicine, University of California, Berkeley School of Public Health, and Samuel Merritt University. He has completed undergraduate degree at University of Rochester, medical school at Medical College of Virginia, and psychiatry residency at University of California, San Francisco Department of Psychiatry. He then enrolled in a 2-year research fellowship in psychiatric genetics before discovering his true passion was in medical education. Deciding that 27 years of formal education just was not enough, he went back to school for master's degree in education at University of California, Berkeley, focusing on quantitative methods and evaluation. Professor Amin's research interests include exploring the efficacy of various instructional approaches in stimulating the health professional students' acquisition, retention, and application of content knowledge in their evolving career as clinicians. Apart from his academic titles, currently, he is the director of Open Learning Initiative at Osmosis, and he promotes Wikipedia editing as a teaching and learning strategy across the health professional schools. In 2013, he created world's first elective course for medical students to receive academic credit for improving health-related information on Wikipedia. By 2018, Wikipedia editing assignments were integrated into formal education settings in 10 health professional schools located in United States, Australia, Canada, Israel, and United Kingdom. Through his work with medical students' contribution to Wikipedia, Professor Amin began working with Osmosis, a health education company dedicated to provide high-quality, accurate health information worldwide. Through his roles at Osmosis, Dr. Amin produced several resources on mental health and well-being, including videos, live YouTube events, and written resources. I welcome Professor Amin Azzam for this session. Thank you.
Hello, everyone. My name is Amin Azzam, and as you heard from the introduction, I am a faculty member at the University of California, San Francisco School of Medicine, at the University of California, Berkeley School of Public Health, and at Samuel Merritt University, all of which are located in the San Francisco Bay Area of the United States. I want to acknowledge that I'm recording this video on behalf of the invitation from Shefeequ Rehman, and thank you for the opportunity to share my reflections with all of you in the Department of Business Administration at Aligarh Muslim University Center in Kerala. I had the privilege of being in India 2 previous times in my life, and so today for you special, I'm wearing one of my kurtas from my time in India. I wasn't in Kerala, but I had the opportunity to experience your beautiful country and people and hospitality. I'm recording this video by request to reflect on some suggestions on mental well-being during COVID-19. And I've been doing a lot of that work here in my country, in the United States. I think it's important to acknowledge, as of today, Tuesday, October 6th, I looked at the numbers. We have 7.5 million cases of COVID in the United States and over 210,000 deaths from this disease. And in India, it's 6.69 million cases and 104,000 deaths from this disease. So both of our countries are struggling with this horrible global pandemic. And as both countries are struggling, we can imagine that there is a tremendously increased burden on the emotional well-being of all the people in both countries, frankly, around the world, actually. So in reflecting on what I wanted to share with you all, I thought it was valuable to leverage the existing resources that I've already produced through my various academic affiliations and my partnerships. And so what I'd like to do is actually share the screen and show you some resources that exist online in addition to the wonderful episodes that are here on this channel. So that way you can seek out additional emotional support. So I'll go ahead and share my screen and show you some resources. So first I want to start with my academic affiliation at the University of California, San Francisco in the Department of Psychiatry. So you will see that that website is psych.ucsf.edu, and that's the public-facing side of our website. At the top right here is a COVID-19 and climate crises mental health resources list. If you look at it, you'll see it's a list of lists. So each of these subsequent topics have additional resources. So for example, emotional well-being and coping during COVID-19. When I click on that, you'll see that there is a number of resources on the web page. As you scroll up, you'll see some of them are for anyone. And so I hope these are also useful to you in India, in Kerala specifically, and any of your colleagues and friends. So these are some tips around staying physically safe, tips to limit your media exposure so that you're not emotionally traumatizing yourself further, eating well, working well enough from home, dealing with isolation and quarantine in terms of psychological effects of social distancing, et cetera, et cetera. There's a tremendous amount of information here, for example, around moral injury and grief, since both of our countries are experiencing tremendous death toll from this disease. Okay, so that is available to you at your convenience. Remember, psych.ucsf.edu, and then on this up here in the top right are a bunch of resources. There's some other things, for example, a resilience and emotional well-being video series. So you can watch some videos produced by colleagues of mine in my department around reducing depression, adopting thoughts that bolster you, a brief positive meditation, pausing and refreshing with yoga, how to deal with extreme emotions, deep breathing. So you can watch these videos at any time. They're all publicly available to you to help with your emotional well-being. Okay. And then there's other resources here as well. In addition to those resources from UCSF, I'd like to show you resources through my affiliation with the company called Osmosisorg. Actually, full disclosure, this company was started by an Indian American medical student at Johns Hopkins University and a medical school colleague of his. And I'm very proud to be a part of Osmosis. So osmosis.org/COVID-19 is the link that I want to draw your attention to. So these are all also freely available resources for anyone in the world to watch about COVID-19. So we have information as we learn more about the disease. There is an online course that you can take for free for continuing medical education credit if you're a health professional. Some videos we've produced around that Osmosis has produced around the disease. And then at the bottom here, you'll see there's a bunch of other stuff, including some information with our Chief Medical Officer, Rishi, also an Indian American. And then some fact sheets that you can print and use. So for example, some online podcasts to listen to, some infographics about which parts of our hands we forget to wash cleanly or most cleanly to minimize the spread of the disease. Stories from around the world, from different countries, and how people are coping and managing COVID. Inspirational stories, some coloring pages for children, if that would help them cope, some additional resources here. So all of that's available there to you as well. Osmosis also has a YouTube channel where we have a number of videos, youtube.com/osmosis. So I'm going to go to that channel next because we have a number of videos. These are all health information videos about different diseases. These are originally targeted towards health professional students, but they're all done so well that I believe that any individual could watch them and appreciate and learn from them around all sorts of different diseases. But I wanted to specifically encourage you to look up in this magnifying glass my name, Azzam. My last name is Azzam. And if you look here, you'll see I have a number of videos that I've produced that in partnership with my affiliation with Osmosis around supporting educators' mental health during high stress periods, tips for maximizing psychological health during stressful times, managing your students' mental health. So for those of you that are faculty in the business administration or other faculty in Muslim University, you will find some good resources here, some previously recorded videos. So for example, I will just go, since it's around supporting students' health, supporting educators. Now let's go to this managing your students' mental health. So this is a brief video. Because it's the public-facing osmosis video, we have to go through the commercials first. Then we will be able to watch the full video. So, hi. My name is Amin Azzam. I'm a psychiatrist by training and at heart a passionate educator of health professional students. I work at 3 San Francisco Bay Area health science universities and also at Osmosis. Today I'd like to talk to you as fellow educators about managing your learners' mental health during times of distress and or crises. I've got 4 key tips. Number 1, explicitly acknowledge. And I'll just jump to the end so you can see all 4 of them on the page. Addressing your concerns. Of course, I think it's a high yield video. It's only 4.5 minutes, but rather than play the whole thing for you during this video produced for you exclusively, I just wanted to show you what the video looks like. So I'll stop sharing. And so again, osmosis.org/ well, you can go to the youtube.com/osmosis. That's our web channel with all of our free videos. So I hope that you will find all of this useful to you in managing your mental health and well-being. Again, you just search on the YouTube channel for my last name and you'll see all the videos that I've had the privilege of producing. Okay. Lastly, as I wrap up this presentation, I'd like to just say this is a tremendously challenging time for all of us. And it's extremely important for you to take good care of yourselves so that way you can all take care of each other and continue in your studies and in your teaching at Muslim University. I like to remind people that social distancing does not mean emotional distancing. So we can still spread joy, share love at a physical distance, and that doesn't spread the virus. So please maximize your emotional connectedness while you minimize your physical touch, so that way we can get through this virus and this global pandemic with the least burden of disease, the lowest loss of life, and the lowest loss of emotional well-being. Take good care of yourselves. Thank you for this opportunity to talk with you, and be safe until we have the chance to perhaps see each other in person someday in the future. As we say in Arabic, inshallah.